Now that we're ready to place the Seal and Protect, we have our patient who's been complaining about sensitivity on 24 and 25 lingual. On clinical examination, we can clearly see that she does have about 1 or 2 millimeters of recession. So let's get started. First, we're going to polish the area with a little bit of pumice. Now, bear in mind that the patient may have a little sensitivity throughout this procedure. So we'll do our best to make it comfortable. So first, I'm going to get a little bit of pumice out of my cup here. Be as gently as possible and just gently debride the surfaces. Next, I'm going to give the patient a little bit of water to swish with. I'm going to get a little bit in the corner, hon, and then you can swish with it. All right. So now I'm going to get everything set up in order to apply the Seal and Protect. Here's what I'm going to use. My micro brush, which comes in a kit, as well as my glue holder. So I'm going to insert the tube and snap it off at the fracture, like so. Inside there is the clear varnish. First, I'm going to want to dry the surface and isolate it as best as I can. So I'm going to place this cotton roll here. Perfect, Joyce. Joyce, this is going to be a little sensitive. Gently spray air on your patient to remove excess saliva. Then you're going to take your micro brush, dip it inside your tube, and you're going to moisten the surface for 20 seconds. And you can see during that time I'm still dipping my micro brush into the tube. Next, you're going to gently spray air on the varnish. You're doing great, Joyce. This is to remove excess. Then you will take your curing light and you will cure the varnish for about 10 seconds apiece. Now, since I'm doing 2 teeth at a time, it'll be 10 and 10. So basically, this procedure is similar to placing a sealant, very much in the same way, with the main difference being that you're applying a sensitivity medicament. Also, it's a clear varnish. The nice thing about this Seal and Protect is that it can be adjusted and monitored, even replaced as the patient comes in every 3 to 6 months as needed to help with the sensitivity. Now, in addition to this, I might suggest this patient do fluoride varnish treatments as well as use a sensitivity toothpaste. So now what we're going to do is reapply a second coat. Because yes, this Seal and Protect requires a second coat, at least 2 coats minimum. So same thing, I'm going to gently dry the area again. And our patient is doing really well. She's maintaining a nice dry environment for me. And I'm going to take my micro brush and moisten the area again for 20 seconds. Now certainly if you notice that your cotton roll was getting damp or dampened, you could replace it at this time before applying the second coat. But seeming as how she's still pretty dry, I'm feeling pretty confident no contamination is going to occur here. So it's been about 20 seconds. I'm going to spray gently again, and we're ready to cure. And I'm going to reassure my patient that she's doing a good job. And at the same time, I'll be reviewing instructions about how to watch out for these, seal and protect. She's able to eat and drink just fine following this procedure. She's not at risk for breaking off the material. And that might occur over time, but nothing to be alarmed about. All right, now that we have placed that, I'm going to remove my cotton roll and I'm going to give her a rinse, because that stuff, if it tastes exactly like it smells, does not taste good. So I'm going to give you a little water on the side to kind of swish with here. All right, now that I've showed you how to place the seal and protect, it's your turn.